Clipping for an orthopedic procedure, you would use the same concepts as you do for an abdominal procedure. The general difference being if your surgery is going to be at the joint, then you would clip up to the joints, distal and proximal. For example, if we're doing stifle surgery on this beagle, you would clip up to the hock and up to the hip. If your surgery was in a non-joint area, for example, right here, you would clip including the joint distal and proximal. It's always better to clip too much than not enough. So I'm going to clip this beagle for stifle surgery. And I'm going to start at the toes. Again, try to keep the blade as flat against the skin as possible to prevent clipper burn. And you can just clip as much hair off as you can this first time through, and you can go over later to get closer if you need to. Clip as much as you can before you hang the leg, which you would normally do for an orthopedic procedure. For areas such as right here by the hock, where there's a lot of different surfaces, you can actually push your finger against the skin to flatten it out, and you can manipulate the skin a little bit so that you can get a closer shave. Same thing here over the stifle. You can pull on the skin to stretch it out and flatten it. Again, the important thing to do is get the hair as close as possible, as short as close as possible, where your incision is going to be made. So since this is going to be a stifle surgery, I'll try to concentrate and get the hair really close right around the knee. Sometimes you need an extra hand or a person to hold your patient for you, and if that's the case, then just ask for it. If you ever have questions about what area on your patient you should clip, always double check with your surgeon or your technician. Up close to the body, you want to make sure that you've got hair removed well around the leg, because they're going to drape that part in. So you want to make sure that you go cranial enough to that leg and caudal enough. For the medial surface, clip up to the midline as much as you can get. Once you have as much hair removed as you can, vacuum all the gross amounts of hair. Now you're ready to hang the leg as it will need to be prepped that way for surgery. Once your foot has been clipped and vacuumed, you're ready to hang the leg. You can do this using some 1-inch tape and making it a stirrup for the foot. Easiest way to do it is place an amount onto the distal part of the foot. The part that's not touching the foot, fold in half. And with the other end of the tape, place that on the other side of the foot. Then with another piece of tape, you can secure it to the hair of that foot to make sure that it doesn't come off. Now this part is your stirrups. You will hang this onto an IV stand. And in this manner, this leg can be sterilely prepped for surgery without contaminating anything. After vacuuming this again to make sure all the hair is removed, you'll next put on some unsterile vet wrap or Coban. The purpose of this is to cover any of the hair that's might be showing and might be in the way of your sterile field. You'll want to make sure to cover the toes as well, so you can go in between the stirrups. And when you're done with this, the foot should be completely encased and no hair should be showing. The prepping, the rough prep for an orthopedic procedure is, again, same concepts as for an abdominal. The biggest difference is that your sterile field is now hanging and you will have to prep in a circular sort of manner, using 2 hands instead of just 1. You'll have the betadine scrub gauze in both of your hands. You will start where your incision is going to be made, and you'll use a slight up and down sort of motion while you move around the limb. And at the same time, you are moving away from your incision site. So we've done the upper half of our limb, or the most distal portion. We're going again to take 2 pieces of gauze, start where incision will be made. This time, again, using the same little up and down motion, work our way down the leg, away, but still away from the incision site. Again, it's important to try not to retrace the path that you took, and once your hair, the gauze touches hair, you toss the gauze away. This will be done a minimum of 3 times, alternating betadine and alcohol. As you can see, an orthopedic prep is going to take longer than your abdominal prep. Now that the patient has been moved into the surgical suite, we can do our final scrub and final prep. For the purposes of this video, I'm going to have my mask removed, but I do have a cap and mask on since this is the surgery suite. The apron has been removed, and I'm in scrubs only, not wearing any white coat. The final scrub is going to be the same techniques, same concept as you used for the rough prep.